I work at Sheikh Shakbout Medical City, which is one of the largest tertiary care hospitals in Emirates of Abu Dhabi. We have the National Trauma and the Burn Center. We also have a large cancer center and a large hematology program. When people come to hospital, one of the first interventions we do is place an IV line, which in some group of patients is challenging because how frequently they come, and it's frequently cause for delays in treatment, worsening patient experience. So we had to create an escalation policy for those who have difficult IV access, largely groups of patients like thalassemia, sickle cell patients, renal patients, cancer patients who comes to hospital all the time. So we created a system in our EMR to capture these patients when they had difficult IV access. So we created a consultation form, and that allowed us to prospectively collect data on these patients. And once we started looking at the data, we saw some recurring themes, which group of patients are affected. Second thing we figured out is we could increase our revenue cycle by attaching a CPT code for difficult IV access. And third thing we figured out is we could upskill our nurses with them use adjuncts like ultrasound to cannulate. What our project allowed us to do is to create a baseline data for the hospital. It's allowed us to create some institutional memory. We know certain group of patients, certain patients come on all the time. And now any interventions we do, we have a benchmark to look at. And this will hopefully help us bring systems engineering principles to improve patient care. I'm grateful for the help Oracle Health colleagues have done that, because they've connected me to many people, many nephrologists across the world who otherwise I wouldn't have had an opportunity to meet. So the cross-pollination of ideas is key, because this solution is used by many doctors. And what problems I'm facing is faced by those physicians as well. And in that journey, I understood what the EMR could do potentially. It's not just a billing software or revenue cycle management software, but it helps us glean frontline patient problems, subsequently helped us develop multiple solutions which were unique for our patient population needs.